Good day to our clinical instructor and to our classmate. So for today's discussion is we're going to discuss about the post-maturity of a newborn. We are the group 1. I am Mary Joy S. Folio.
I am Gian Nierdino.
I am Sara Del Castillo.
And I am Jessamine G. Felicio.
Okay, so for the table of contents, we have first the general objectives. The next is specific objectives. Then the introduction, the anatomy and physiology. Next is health history, the genogram, the physical assessment, the pathophysiology, laboratory and diagnostic examinations, drug study, nursing care plan, and lastly is the references. So here are our general objectives. So at the end of 2 hours discussion with various teaching learning activities, the learners will be able to describe and enumerate all the nursing diagnoses that can be concluded from post-term infant. Next is distinguish the normal anatomical and physiological adjustment from body systems, changes, and complications associated with post-maturity. Then identify the different drug study that can help in preventing further risk associated with post-maturity and identify the internal and physical changes in post-term infant. Then for the skills, demonstrate and apply the different kinds of treatment and management for post-term infant, then develop skills or techniques and relate the signs and symptoms of post-maturity in newborns to provide proper care and management. Then for evaluation, acknowledge the significance of knowing the risk factors, the disease process, and signs and symptoms of post-term infant, and assess the efficacy of drugs that are administered in post-term infant for follow-up or adjustment of treatment regarding the condition of the newborn. So here are the specific objectives. So at the end of 2 hours discussion, the learners will be able to determine the specific medications for complications that might occur to a postterm infant and be familiar with its mode of action, explain how postterm pregnancy happens inside the body, then explain why the nursing interventions laid out in the nursing care plan are appropriate for the patient's situation, then gather knowledge of the patient's present health state, health requirements, and health related goals, and identify the diagnostic laboratory result changes that may lead to the identification of the complications, then identify the different factors that cause post-term pregnancy, and identify the normal anatomical and physiological changes during the birth of the newborn for easy and early detections of the signs and symptoms of post-maturity. Then recognize the different nursing priorities and specific nursing intervention for the patient. And lastly, understand the state of health of the patient further. So now we arrive to the introduction. So a postterm infant is one born after the 42nd week of pregnancy according to Moore and Martin 2003. So a postterm newborn is a baby delivered after 42 weeks of gestation. So gestational age refers to how far along the fetus is. As we all know that the gestational age is the number of weeks between the first day of the mother's last menstrual period and the day of delivery. So this time frame is often adjusted according to other information received by the doctor. For example, the results of the early ultrasound scans and the additional information regarding the gestational age. So the baby is estimated to be due at 40 weeks of gestation. And most nurse, midwives, and the obstetricians recommend inducing labor at 2 weeks postterm to avoid post-mature birth. So the labor induction. So as we all know that the other term of the labor induction is also called inducing labor. So this is to this is done by prompting the uterus to contract during pregnancy before labor begins on its own for a vaginal birth. So a healthcare provider might recommend inducing labor for various reasons. So primarily when there is a concern for the mother's or baby's health. So this is an important factor in predicting whether an induction will succeed or how soft and expanded the cervix, which is called the cervical ripening. So the gestational age of the baby as confirmed by early regular ultrasound is also important. So if a healthcare provider recommends labor induction, then it's typically because the benefits outweigh the risk. Then, however, when the gestational age has been miscalculated, or if some of other reason labor is not induced until week 43 of pregnancy or after, the pregnancy may result in a post-term infant. So um, then an infant who stays in utero for past week of the 42nd week of pregnancy is at special at risk because a placenta appears to function effectively for only 40 weeks. So as we all know that if the placenta shrinks enough, it may not provide adequate oxygen to the fetus. So particularly during labor, a lack of adequate oxygen may result in fetal distress. So this is the signs that the fetus is not well, and in extreme cases, for example, this may result in injury to the brain and other organs. So one example that is meconium. So this is the fetus stool in the amniotic fluid. So this may reflexively take deep gasping breath triggered by the distress when the baby is distressed. So thereby, the newborn may inhale the meconium containing the amniotic fluid into the lungs before birth. So as a result, the newborn may have difficulty breathing after delivery. So this is what we called the other term for meconium aspiration syndrome. Okay. So after that time, it seems to lose its ability to carry nutrients effectively to the fetus, as what I've mentioned earlier. And the fetus who remains in utero with a failing placenta may die or develop post-term syndrome, as what I mentioned earlier. So infant with this syndrome may have many of the characteristics, just like in a small gestational age, for example. So it may have dry, crack, almost leather-like skin from the lack of fluid and absence of vernix. So near the end of a term pregnancy, the level of the amniotic fluid decreases and the placenta becomes smaller, and it may less effective in providing oxygen and nutrients. So to compensate, the fetus begins to use its own fat and carbohydrates or sugar to provide energy of its own. So as a result, the newborn's growth may slows down and its weight may even decrease. So after the delivery, the postterm newborns are prone to developing low blood sugar or the hypoglycemia because they have exhausted their supply or of the stored fat and carbohydrates during the labor. So now we arrive to the statistics of this complication of the infant. So the incidence of the postterm pregnancy is about 7% of all pregnancies, and the prevalence varies depending on population characteristics and local management practices. And the neonatal and maternal complications associated with this condition have always been underestimated. And it is not very well understood why some women become post-term, although there are factors like the obesity, the hormonal, and the genetic factors have been implicated. So the management of the post-term pregnancy constitutes a challenge to clinicians. Okay, so the next slide is for the anatomy and the physiology. So the infant's body undergoes changes to adapt to adapt life outside the womb. Okay, so for the lungs, heart, and blood vessels, increased oxygen in the lungs causes a decrease in blood flow resistance to the lungs. Blood flow resistance of the baby's blood vessels also increases. Fluid drains or is absorbed from the respiratory system, and the lungs inflate and begin working on their own, moving oxygen into the bloodstream and removing carbon dioxide by breathing out, or what we call exhalation. Then, neonates are obligate nose breathers and have narrow nasal passages, which account for a baseline airway resistance they must overcome. So, as we all know, that changes in the cardiovascular system are necessary after birth because now the lungs must oxygenate the blood that was formerly oxygenated by the placenta. So there is a big difference. So the mother's placenta helps the baby breathe, as we all know, while it is growing inside the womb. And the oxygen and carbon dioxide flow through the blood in the placenta, and most of it goes to the heart and flows through the baby's body. So at birth, the baby's lungs are filled with fluid, so they are not inflated. So the baby takes the first breath within about 10 seconds after delivery, and this breath sounds like a gasp. So as the newborn central nervous system reacts to the sudden change in temperature and environment. So next is for the body temperature of the newborn. So a developing baby produces about twice as much heat as an adult. Then, after delivery, the baby newborn begins to lose heat. Then, the baby's body creates heat by burning stores of brown fat. This is a type of fat found only in fetuses and newborns. So, an infant's normal body temperature will vary based on age, activity, and time of day. So, infants tends to have higher average temperatures than older children and adults. So, for example, the 37.5 degrees Celsius or 99-degree Fahrenheit. So, an infant's normal core body temperature will vary by as much as 1 degree to 2 degree Fahrenheit throughout the day. So, typically, the core body temperature will rise during the day and slightly lower during the night while the infant is sleeping. So, fever is defined as the body temperature elevated above the normal, and it is generally accepted that for the appropriately dressed child at rest, fever is present with a rectal temperature of 38 degrees Celsius or 100.4 degree Fahrenheit or an oral temperature of 37.2 degree Celsius. Then for the liver, so this acts as a storage site for sugar or glycogen and iron. Then it produces substances that help the blood to clot. Then begins breaking down the waste products such as excess red blood cells. Then this produces a protein that helps break down bilirubin. So in the newborn, the liver is relatively immature and undergoes several changes in its functional capacity during the early postnatal period. So the essential liver functions can be classified into three categories. So we have the metabolism, the detoxification, and bile synthesis. So in general, the immature liver function has limited consequences on the healthy term neonate. However, in preterm newborn, they are particularly susceptible to the effects of the immature liver functions, placing them at risk of hypoglycemia, hyperbilirubinemia, bleeding, and impaired drug metabolism. Then, next is for the gastrointestinal tract. So in late pregnancy, the baby produces a tire green or black waste substance called meconium. So we are all familiar about that. And in some cases, the baby passes stools or meconium while it is still inside the uterus. So meconium is the early stool passed by a newborn soon after birth. And before the baby starts to feed and digest milk or formula, in some cases the baby passes meconium while still inside the uterus. So this can happen when the babies are under stress due to the decrease in blood and oxygen supply. Then next is the immune system. So the immune system is relatively sterile environment. As soon as the baby is born, they are exposed to a variety of bacteria and potential disease-causing substance. And the newborns do carry some of the antibodies from their mothers, which provide them protection against infection. And breastfeeding also helps improve a newborn's immunity. So that is for immune system. So as we all know that the baby's immune system are not as strong as those of adults. So we all know that na ang immune system sa baby is dili jud siya strong compare nato. So breastfeeding and vaccinating the baby will help protect them from a serious illness. So antibodies are passed from mothers to baby through the placenta during the third trimester, and this gives the baby some protection when they are born. So the type and amount of antibodies passed to the baby depends on the mother's level of immunity. So, and during birth, bacteria from the mother's vagina is passed on the baby. So this helps to build the colony of bacteria in the gut that contributes to their immunity. And after birth, more antibodies are passed on the babies in colostrum and in breast milk, but babies' immune system are still not as strong as adults. Just like in premature babies, they are greater risk of infections because of their immune system are even more immature. So they haven't had as many antibodies passed to them from their mothers. So babies produce their own antibodies every time they are exposed to a virus or germs, but it takes time for this immunity to fully develop. The next is the skin. So newborn skin will vary depending on the length of pregnancy. The skin of a full-term infant is thicker. A fine hair called lanugo might cover the newborn skin, especially in preterm babies. A thick, waxy substance called vernix may cover the skin. This substance protects the baby while floating in the amniotic fluid in the uterus. And the skin might be cracking, peeling, or Yoshi, but this should improve over time. So at birth, the skin of the normal newborn is reddish or purple in color and turns bright red when the baby cries. So during the first few days of life, the skin gradually loses this redness, and in addition, the newborn's hands and feet may be cool and blue. So by the third day, the newborn may also appear slightly yellow. So that is for the anatomy and physiology. Now, let's move on to the health history.
So I will be discussing about the health history. So next slide, please. So for the biographical data, so the admission is in May. So for the biographical data, so the admission is in May 18, 2022, Name is Baby Boy Villarin. Address is Panubigan, Canlaon City. So for the contact number is 09XXX, and the age is newborn. And for the biographical data, for the admission is May 18, 2022. Name is Baby Boy Villarin. Address is Panubigan, Canlaon City, and that is the contact number. And the age is newborn, and birthday is May 18, 2022. Place of birth is in Dumaguete City. Sex is male, and uh, the contact person is RBV, nationality is Filipino, and the religion is Roman Catholic. So next slide, please. So reasons for seeking healthcare. So baby boy Villarin is a 41.37 weeks baby and weighs 4,295 grams. Patient appears to be febrile with a temperature of 38 degrees Celsius, and upon repeat examination, it became 37.7 degrees Celsius, which means that the patient has fever and his white blood cells and hematocrit levels are also high. So next slide. So for the history of present illness, so 3 days prior before hospitalization, the mother of the newborn is referred to NOPH or the Negros Oriental Provincial Hospital due to elevated fever. And according to the mother, she has been diagnosed with tuberculosis. She had been diagnosed of cesarean second stage prolonged labor, which the baby weighs 4,295 grams with an age of gestation of 41.37 weeks. At birth, the baby is febrile, having temperature of 38 degrees Celsius and diagnosed with LGA. Next slide, please. Next slide, please. So for the current health status, patient is 41.37 weeks old infant who appears to be large for gestational age, weighing 4,295 grams. He is also febrile with a temperature of 38 degrees Celsius. Also, patient's white blood cells and hematocrit levels are high. So next slide.
So next is we have the genogram. Next slide, please. So the genogram consists of the grandparents of the infant as well as his parents. And for the legend, we have their TB, tuberculosis, HB, hypertension, DB, diabetes, RI, respiratory infection, and AW, life and well. Next slide, please.
So next is for the physical assessment. So next slide, please. So for the general health survey, so a 31 37 weeks baby febrile at birth and delivered via cesarean section. So the vital signs, temperature is 38 degrees Celsius, pulse rate is 148 beats per minute, respiratory rate is 50 cycles per minute, oxygen saturation is 95%. So the growth parameters, weight is 4,295 grams, length is 54 centimeters, head circumference is 34 centimeters, chest circumference rather is 36 centimeters, and the abdominal circumference is 32 centimeters. So next slide. So for the skin upon inspection, there is a presence of lanugo, dry, loose, and peeling skin. It is flaky, scattered petechiae over the trunk, absence of vernix, leather-like skin. Next slide. For the head, upon inspection, the anterior fontanelle has already closed. Skull is asymmetrical and head circumference is normal. Scalp veins are not dilated. No swelling noted upon inspection. Abundant scalp hair. And then upon palpation, the sutures felt like ridges upon palpation. Fontanelles are soft and flat. Cranial bones are soft or pliable. And then next. For the eyes, both eyes are sensitive to light. Normal eye contact. Each eye's cornea is spherical in shape and more alert and wide-eyed. Next slide. So for the ears, upon inspection, the pinna of the infant's external ear bends forward, no deformities present. The auditory canal does not have any discharges and foul odors. Patient is responsive to sound, no hearing problems noted, and then upon palpation, the texture is noted to be normal, smooth, and has bony structures. The uricles are elastic and no pain upon palpation. So next. For the nose, upon inspection, patient has runny nose, nasal passages are obstructed. Nasal symptom is noted to be in the midline without bleeding or deviations. Next. For the mouth, upon inspection, patient produces lots of saliva and drools frequently. No lesions and redness present. Patient has high-pitched cry. So for the neck, upon palpation, lymph nodes are palpable without additional masses. No fracture and tenderness present in the clavicle. And the next. So for the chest, infant's chest appears to be tiny and has little musculature. The chest is 5 centimeters smaller in size than the head and is wide across the anterior-posterior diameter. So next. For the abdomen, upon inspection, no redness or swelling around the umbilicus. And then upon palpation, the tip of the xiphoid process often protrudes anteriorly, immediately beneath the skin. Rib cage is soft and pliant. Upon auscultation, vowel sounds are present. So next. So the anogenital area upon palpation, anus is not covered by a membrane or the imperforate anus. So when checking for anal patency. So next. For the male genitalia, urinary meatus at tip of glans penis, palpable testis in scrotum, large edematous, pendulous scrotum with rugae. Next. For the back, upon inspection, the back is rounded with normal muscle bulk, no presence of enlargement or abnormal growth. And then next. For the extremities, maintains posture of flexion, equal bilateral movement and tone, full range of motion in all joints, 10 fingers and there are 10 fingers and 10 toes, negative hip clicks, grafts reflex present, and legs appear bowed, palmar creases present and the sole creases present. Next. And the nails are overgrown both in hands and feet. And then for the neurologic, it maintains position of flexion. When prone, turns head side to side, holds head and back in horizontal plane when held prone, ability to hold head momentarily erect. Next. So that is all for the physical assessment.
Okay, so now I will be discussing the pathophysiology of postterm pregnancy. Okay, so I'll just open or proceed with the file. Okay, so as you can see here in our legend for our flowchart, we have the risk factors, which will be filled by a peach color, the pathophysiology of the complication, which will be filled by the blue color, the signs and symptoms filled by the gray color, assessment findings filled by the pink color, and the laboratory results, which will be filled by the blue-green color, nursing management filled by violet color, and medical management will be filled by the green color. So we'll now proceed with the risk factors. So we have here predisposing factors and precipitating factors. We have here the primiparity, of course, because according to researches or studies, primiparity is and postterm pregnancies have a common occurrence between the two. And if the mother is a first-time mother, there's a high incidence of postterm pregnancy or untimely labor. And we also have previous postterm pregnancy, and if the mother had also a postterm pregnancy, there are also higher incidences that that the next pregnancy that she will have will be also postterm. Another factor would be obesity. Okay, as mentioned by my group mate before in the introduction, obesity also, or BMI, also plays a also is a factor for postterm pregnancy. Altered levels of circulating hormones is also a factor, because when there is altered release of hormones, there will also be complications or delay that may occur during the progress of labor and ultimately delivery. And also genetic factors. If the patient is also a postterm baby, tendency is the patient will also proceed to postterm pregnancy. And for the precipitating factor, and is also a major factor for postterm pregnancy, the inaccurate dating of gestation age. So miscalculations when it comes to expected date of delivery. There will tendencies like postterm pregnancy will also occur, but that can also be easily ruled out, and I will mention that during the disease process or the pathophysiology of postterm pregnancy. Okay, so we double check. Okay, so first off, the sperm cell fertilizes the egg cell. So during copulation, the male and the female will copulate, and when the male will ejaculate inside the vagina of the female, sperm cell will for sure fertilize the egg cell of the female, and continuously the zygote will slowly develop into a fetus. So one factor here would be, or when inaccurate dating of gestation age will occur, there will also be, that will also lead to untimely labor or postterm pregnancy. One solution for that would be first trimester ultrasonography. Okay, so with first trimester ultrasonography, that inaccurate dating of gestation age will be easily disregarded. Okay, so postterm pregnancy, um, the pathophysiology for that complication is lacks data. Okay, wait for a moment. Okay, wait. Okay, so for the postterm pregnancy, data is lacking, and more studies lean more on the altered levels of circulating hormones. Okay, so what happens is inside, or the fetus will should release CRH, or corticotropin releasing hormones, from the fetal hypothalamus, and then if CRH is released from the hypothalamus, um, ACTH, or the adrenocorticotropic hormone, will be released from the pituitary gland. Okay, and then when there is a release of ACTH, there will also be a release of DHEAs, or dihydroepiandrosterones, which with the release of DHEAs, there will also that will signal the placenta, um, which helps release estrogen inside the maternal, or the body of the mother. Okay, and then in a normal tendency, estrogen progesterone ratio is increasing in an ideal rate. Okay, but for postterm pregnancy, there is a complication on the rate of exponential rise, or the release of hormones. Okay, so the fetus will have a slow exponential rise of corticotropin releasing hormones from its hypothalamus, and when there is slow release, or slow rise of corticotropin releasing hormone, there will also be a slow release of ACTH. And then when there is a slow release of ACTH, there will also be a slow release of DHEAs, or dihydroepiandrosterones, from the fetal adrenal glands. So regardless if there is slow or normal or a high rate of releasing of DHEAs, regardless if DHEAs are released, it will signal, or go to the placenta and signal the placenta to release estrogen inside the mother's body. But in here, DHEAs are since DHEAs are also slowly released, it signals the placenta to still release estrogen, but in a slow rate. Okay, so if there's a slow release of estrogen, progesterone ratio is slowly increasing. Okay, and then if the estrogen progesterone ratio is increasing in a slow rate, chances are there will also be, or the releasing of prostaglandins and oxytocin will be affected as well. So there slow increase in prostaglandin release, and also there will be slow release of oxytocin in the maternal pituitary gland. So when these two chemicals are slowly released, so instead of the mother being able to deliver earlier, or deliver within term, there will chances are untimely labor will happen. And then when untimely labor happens, postterm pregnancy will proceed. Okay, so what are the signs of postterm pregnancy? When the baby is born, there will be you can see a green, brown, or yellow coloring of skin from the baby, which is from the passing of stool in the womb. Okay, there will also be a small amount of fat on the baby's body, since the fat found that can be found in the baby's body has been already consumed for energy consumption during postterm pregnancy. Also, postterm babies are more alert and wide-eyed. Okay, as mentioned also by my group mate in the physical assessment. Also, large amount of hair on the head can be found or observed, and overgrown nails, dry, loose, peeling skin, and visible creases on palms and soles of feet. So those are the signs of postpartum pregnancy. So what can we do to help the mother deliver during postpartum pregnancy? We can induce labor through chemicals, injection of oxytocin, or also stimulation, or we can also as you can see here, breast stimulation. That can also be a nursing intervention. Okay, so breast stimulation can actually release oxytocin, since it signals the mind or the brain to release oxytocin, since the nipple has been um, stimulated, which also can release milk. Okay, or also we can promote unprotected sex between the mother and her significant other, because ejaculation of semen inside the vagina can also or semen itself has prostaglandins, and when there is an increase of prostaglandins, there can also be dilation of the cervix. Okay, so what happens when postpartum pregnancy occurs? There are two pathways: aging of placenta and the fetal weight gain. Okay, so these two are unavoidable when postpartum pregnancy occurs. So we'll go first with aging of placenta. Okay, I'll check first. Okay, so aging of placenta. What happens when the placenta of the baby ages? There will be placental insufficiency. Placental insufficiency means that the placenta could no longer sustain nutrients for the baby. Okay, so and also it can also reduce the transmission, or the can also placental insufficiency can also help, or placental insufficiency can affect the respiration um, inside the womb of the mother. Okay, so one pathway here is that fetal hypoxia and acidosis can occur if there is placental insufficiency, because with placental insufficiency, the placenta can no longer function well. So tendency is there will also be fetal hypoxia and acidosis, and with fetal hypoxia, or the lack of oxygen, and the acidosis, the high levels of acid inside the bloodstream of the baby, chances are the baby can be found dead inside the womb, or stillbirth can occur. So another pathway for placental insufficiency would be the decreased amount of amniotic fluid. Okay, so when there is a decreased amount of amniotic fluid, there will be oligohydramnios. So that's just another term for low amount of amniotic fluid inside. So what happens when there is oligohydramnios? There will be fetal compression and meconium aspiration. So fetal compression is fatal as well, because it can also lead to fetal hypoxia and acidosis, since you're compressing the fetus itself, or fetal compression can happen since there is less moving space for the baby to occur. Sorry about that. Okay, that is different from umbilical cord compression. I'm sorry. So fetal compression can happen because since there is a lack of amniotic fluid, the fetus can no longer freely move inside the womb of the mother, and tendency is the baby will be having a hard time moving inside, and the baby will be restricted in its movements and be slowly compressed. Okay, so another pathway is meconium aspiration, as mentioned by my groupmate also in our introduction. Okay, so aspiration of meconium can occur. So what nurses can do is suction therapy, or suctioning the airway of the baby to help the baby breathe properly. Okay, so next pathway, um, aside from aging of placenta, if postterm pregnancy can occur, there will also be fetal weight gain. That will also happen because fetal weight gain should happen because the baby is staying longer inside the womb as expected. Okay, so the doctors can have options for the mother to have a cesarean delivery, or small chances can occur during for the small chances can occur, or small chances can occur for operative vaginal delivery, like for using forceps, okay, or another instrument to deliver the baby through the vagina. Okay, even if the baby is heavier than expected, or the heavier than the normal range of weight. Okay, so what we can do as nurses, if let's say the obstetrician gynecologist has the permission or the consent of the mother to proceed with cesarean delivery, as nurses we can proceed with performing abdominoperineal shaving and prepare the mother for surgery. Okay, so once the mother is prepared for surgery, cesarean delivery can be already performed, and upon CS, upon CS, we found that the baby's weight is 4,295 grams. Another pathway would be the operative vaginal delivery. Okay, so when we force the mother to deliver through the vagina, even if the weight of the baby is above normal or macrosomic, chances are there will be shoulder dystocia and birth trauma. Okay, so that is it for the pathophysiology. So now I will hand over the floor to my groupmate, Jessa Felisco.
Okay. Next is the laboratory and diagnostic examination. Next slide, please. Okay, so first is we have there the complete blood count. Description, this is used to help assess the likelihood of infection and the need for antibiotics. So white blood cell, we have there the normal values and results. So for the significance, the white blood cells, the infant is high, and this indicates that there is infection. White blood cells are multiplying to destroy the bacteria or the virus. Next is we have the red blood cells. So the red blood cell of the infant is normal. Hemoglobin is high. This indicates high because the normal values is 12 to 14, while the result is 20.50. So this is high. So this indicates high concentration of red blood cell, may indicate polycythemia due to post-maturity. Next is we have hematocrit. So it is also high. The normal values is 37.0, 63.60%. So high hematocrit may indicate that polycythemia is present, and this is due to a post-maturity because of young red blood cells. MCH also high, and this may indicate again polycythemia. And for the MCHC is normal, RDW is normal, platelet count is normal, and the MTV is normal. Next is we have the differential count. We have neutrophils, normal, and the lymphocyte is low. So the normal values is 20 to 45, and the result is 17.60. So low, this may indicate an inherited syndrome and be associated with certain diseases, or be a side effect from medications or treatment. Next is we have monocytes, the eosinophils, and the basophil, they are all normal. Next slide, please. Okay, next is we have another laboratory exam, the C-reactive protein test, or the CRP. This is used to check for inflammation due to an infection. For the CRP, the normal values ranges from 0.1 to 4.1, and the result is less than zero point 0.5. So this signifies that the CRP is normal. Next is we have the ABO test. So description, the ABO test is a common blood type test. The ABO test shows which of four blood types your child has. It's either A, B, AB, or O. So the genotype of father, we have AO. Genotype of mother, we have BO. And the baby blood group is AB, ABO. Genotype of baby blood group is AO, BO, AB, and OO. Next slide, please. Okay, next is we have the diagnostic exam, the newborn screening. So description, the test often scans for genetic and metabolic abnormalities, hearing problems, specific heart problems, and other conditions that can hinder their development. For the disorder, we have the amino acid disorders, normal, fatty acid disorders, normal, organic acid disorders, normal, galactosemia, normal, biotinidase deficiency, normal, hypothyroidism, normal, pH, normal, and for the hemoglobinopathies, abnormal. To analyze the hemoglobin insignificance, this is elevated and may indicate polycythemia. For the cystic fibrosis, we have the normal. Next slide, please. Another diagnostic exam is the ultrasound report obstetrics. So this biophysical profile was done last February 19, 2022. This is test can provide information about a baby's growth, development, and overall health. For the results, for the biometry, BPD is 7.6 centimeters, 30 weeks and 4 days. HC 27.2 centimeters, 28 weeks and 4 days. AC 23.3 centimeters, 27 weeks and 3 days. FL 5.3 centimeters, 28 weeks and 5 days. So last February 19, the average ultrasonic age 28 weeks and 5 days, and the ultrasonic age expected date of consignment is May 9 or 5/9, 2022, and the EFW is 1,191 grams. Next slide, please. And next is we have the autoacoustic emission or OAE test. So the OAE test checks part of the inner ear's response to sound. The test is mostly done on infants and children who may not be able to respond to behavioral hearing tests because of their age. So for the right ear, the frequency is 1,500 dB per decibel is 10. Result pass. Frequency is 2,000 dB is -2. Result pass. Frequency is 3,000 dB is -3. Result pass. And for the left ear, we have there's a frequency 1,500 dB is 14. Result pass. 2,000 dB is -1. Result pass. And lastly, we have 3,000 frequency dB is -3 and result is pass. Next slide, please. Okay, next is we have the drug study. Next slide, please. Okay. First drug is the erythromycin ophthalmic ointment. Classification, this belongs to the macrolide antibiotics. And for the dosage, half-inch ribbon of ointment within 1 hour of delivery. To the route, this is topical route, and the mechanism of action acts by inhibition of protein synthesis by binding to the 23S ribosomal RNA molecule in the 50S subunit of ribosomes in susceptible bacterial organisms. Next slide, please. For the indication, so erythromycin ophthalmic ointment is used to prevent certain eye infections of newborn babies, such as neonatal conjunctivitis and ophthalmia neonatorum. For the contraindications, this is contraindicated in patients with liver disease, heart rhythm problems, and myasthenia gravis for the neuromuscular disease. Next slide, please. For the side effects, we have the redness, tenderness, dryness, and mild rash at the site of application, and chemical conjunctivitis or edema or inflammation. Next slide, please. Okay. So the adverse reactions, we have the problems breathing, wheezing, or chest tightness, swelling of the face, lips, tongue, or throat, severe nausea or vomiting, severe watery bowel movements or abdominal pain, blistering, peeling skin or severe skin rash, skin or eyes turning yellow, pale colored stones or dark colored green, fast, slow, or irregular heartbeat, severe dizziness or fainting. Next slide, please. Next is we have the nursing responsibility. So this is to promote bonding by facilitating eye contact between parents and infant during this period, but delay installation no longer than 1 hour after delivery. Next is you need to wear gloves for administration of eye ointment. And do not place tube of eye ointment on the radiant warmer with infant before administration. Next is administer erythromycin ophthalmic ointment prior to administration of vitamin K and hepatitis B injections. Infant may cry following injections, making administration of ophthalmic ointment more difficult. Next is administer erythromycin ophthalmic ointment from inner canthus to outer canthus and lower conjunctival sac of each eye. So do not touch eye with applicator. Lastly is following administration close eyes to more evenly distribute ointment. So after 1 minute, may blot eye with gauze to remove excess ointment. Do not irrigate eyes following installation. Next slide, please. Okay, for the client teaching, we need to instruct the patients regarding the drug action, purpose, and side effects. Tell parents that any edema around the eyes usually disappears within 24 to 48 hours. And lastly, explain that administration of eye prophylaxis is federally and state mandated and that there is no risk to vision from the ointment. Next slide, please. For the significance, this is to prevent gonococcal conjunctivitis and chlamydial conjunctivitis, which can cause blindness. Next slide, please. Okay, another drug is the phytonadione or the vitamin K. So this belongs to the classification vitamins. Dosage is 0.5 to 1 milligram within 1 hour after birth. The route is intramuscular. In the mechanism of action, it catalyzes the hepatic synthesis of blood clotting factors, including active prothrombin. Next slide, please. Okay, for the indications, phytonadione prevents hemorrhagic disease of the newborn. And for the contraindications, hereditary hypoprothrombinemia, renal impairment, cases of over anticoagulation due to heparin, and hypersensitivity to vitamin K. Next slide, please. Okay, for the side effects, we have pain and edema at the injection site. And for the adverse reactions, we have urticaria, rash, hyperbilirubinemia, and jaundice. Next slide, please. And for the nursing responsibilities, protect drug from light because of photosensitivity of the preparation, cleans anterolateral site before injecting drugs. So if alcohol is used, allow to dry prior to drug administration. Next is in phytonadione or vitamin K is in a glass with withdraw medication with a filter needle. So change needles and use a 25 gauge or 5/8-inch needle to administer in either vastus lateralis or rectus femoris muscle. Lastly is stabilize infant's leg prior to administration of observed injection site for edema and inflammation. Next slide, please. Okay, for the client teaching, instruct parents regarding the drug action, purpose, and side effects. For the significance, so newborn does not receive adequate vitamin K transplacentally and is unable to synthesize vitamin initially because of limited intestinal flora. Therefore, production of clotting factors in liver is hindered and low prothrombin levels are evident. Phytonadione facilitates production of clotting factors equal to natural vitamin K. Next slide, please. Okay. Another is we have the hepatitis B vaccine. So this belongs to the vaccines, inactivated and viral. For the dosage, we have 0.5 ml within 12 hours after birth, repeated at 1 month and 6 months. For the route, we have intramuscular, and for the mechanism of action, this stimulates the immune system to produce anti-HB without exposing the patient to the risk of active infection. Next slide, please. For the indications, hepatitis B vaccine provides passive immunization against all subtypes of hepatitis B virus. For the contraindications, we have their severe allergic reaction after a previous dose or to a vaccine component. This is also a contraindicated in age, um, less than 6 weeks or more than 7 years, and also encephalopathy within 7 days of administration of previous dose of BCG. Next slide, please. For the side effects, we have soreness at injection site with edema, warmth, erythema, and induration. For the adverse reactions, we have breathing that stops during sleep, fever, chills, swollen glands, fussiness, irritability, crying for an hour or longer, unusual muscle weakness, changes in behavior, or severe skin reaction. Next slide, please. For the nursing responsibilities, we have scale, shake vial well before withdrawal of medication, discard if other than slightly opaque white suspension. Another is cleanse anterolateral site before injecting drugs. So if alcohol is used, allow to die prior to drug administration. Next is inject complete contents of vials so do not dilute. And lastly, have epinephrine ready for allergic reaction. Next slide, please. For the safety, give IM invastus lateralis to rectus femoris, document administration and site and chart, record lot number, expiration date, name and title in chart, store product at 35.6 degrees Fahrenheit to 46.4 degrees Fahrenheit, and do not freeze. Okay, next slide, please. For the significance of hepatitis B virus infection may result in serious long-term liver disease, cancer, and death in adulthood. So the goal of immunization is to reduce the number of chronic carriers of the virus in the population, thus preventing HBV infection. Next slide, please. So another is Amphicillin. This belongs to the penicillin, and the dosage is 250 mg every 12 hours. For the route, this is intravenous. The mechanism of action, interference with cell wall synthesis by attachment to penicillin binding proteins, inhibition of cell wall peptidoglycan synthesis, and inactivation of inhibitors to autolytic enzymes. Next slide, please. For the indications, ampicillin is used for treatment of bacterial infections, including sepsis and meningitis. And for the contraindications, this contraindicated in people with a history of hypersensitivity to any penicillin. Next slide, please. For the side effects, we have nausea, vomiting, and diarrhea. And for the adverse reactions, we have serum sickness-like reactions, erythematous maculopapular rashes, exfoliated dermatitis, urticaria, and seizures. Next slide, please. And for the nursing responsibilities, watch for seizures, notify physician immediately, monitor signs of pseudomembranous colitis, including diarrhea, abdominal pain, fever, pus, mucus and stool, and other severe or prolonged GI problems, monitor signs of allergic reactions and anaphylaxis, assess muscle aches and joint pain that may be caused by serum sickness, monitor signs of blood discussions such as eosinophilia and leukopenia. Next slide, please. For the significance, so ampicillin is used to treat certain infections that are caused by bacteria such as meningitis or the infection of the membranes that surround the brain and the spinal cord. Next slide, please. Okay, next is we have the amikacin. Classification is aminoglycoside antibiotic. Dosage is 45 milligrams and the route is IV. Mechanism of action it binds to bacterial 30S ribosomal subunit and interferes with mRNA binding and tRNA acceptor sites, interfering with bacterial growth. Next slide, please. For the indications, this is given if there is suspected or proven late onset neonatal sepsis, and for contraindications, extreme caution in neonates with renal dysfunction. Next slide, please. Okay, for the side effects, we have their soreness or discharge at the injection site, high temperature or fever, and headache. For the adverse reaction, We have ototoxicity, renal impairment, and hepatotoxicity. For the nursing responsibilities, throw and pick levels if requested, 1 hour after the infusion commences, 30 minutes after the infusion ceases. Observe a site for extravasation during administration, and observe for signs of renal, hepatic, and hematological dysfunction during prolonged therapy. Next slide, please. Okay, for the storage, a store prepared syringes in fridge and the open vials need to use immediately and discard remainder. Next slide, please. The significance, specifically for neonates, amicacin plays an important role in the treatment of neonatal sepsis, necrotizing enterocolitis, meningitis, and empirical antibiotic therapy. Lastly is we have the Bacillus calmette-guerin or BCG. This is belongs to the classification of vaccines and dosage is 0.5 ml. The route is intramuscular. The mechanism of action involves a combination of its direct effect on tumor cells along with the patient's immune response to the therapy. Next slide, please. For the indications, so BCG is a vaccine given to a newborn to protect them from serious forms of tuberculosis or TB, such as TB meningitis, an infection of the brain, and miliary TB, widespread infection. For the contraindications, this is contraindicated for those receiving corticosteroids or other immune suppressive treatment, including radiotherapy, and those suffering from malignant conditions such as lymphoma, leukemia, Hodgkin's disease, or other tumors, or the reticuloendothelial system. Next slide, please. Side effects, we have their soreness or discharge where the injection was given, high temperature or fever, headache, swollen glands under the armpit and the arm where the injection was given. Next is for the adverse reaction. We have their abscess, bone inflammation, and widespread TB. Next slide, please. For the nursing responsibilities, you need to monitor for SNS of systemic BCG infections, fever, chills, severe malaise or cough, culture blood and urine. So if systemic infection is suspected, assess for regional lymph node enlargement and report fistula formation. Next slide. Patient and family education. So review potential adverse effects. Keep the vaccination site clean until local reaction has subsided, and do not breastfeed until cleared to do so by physician. Next slide. For the significance, so the Bacillus calmette-guerin or BCG vaccination is given to newborn babies at risk of getting tuberculosis or TB. TB is a very serious infectious disease that can cause TB meningitis in babies.
Okay, so now we will be discussing the nursing care plan for our specific case. So for the first assessment, we have the objective cues. Okay, so the temperature of the baby upon initial care was 38 degrees Celsius, and upon laboratory testing or the CBC of the patient or the baby, results were obtained, and we gathered data. So the white blood cell count for the baby is 29.20 cells per cubic millimeters, and the lymphocyte percentage is 17.6%. Okay, so for the W or the white blood cell count, 29.2 cells per cubic millimeters, that is considered already high in NOPH, and in for the lymphocyte percentage, it is considered low in the institution. Okay, so next slide, please. Okay, so we have the first nursing diagnosis. So priority number one. Okay, so risk for infection related to suspected bacterial infection as evidenced by high temperature and white blood cell count. Okay, so next slide please. Okay, so we have the plan or objectives uh, of our care plan. So after 48 hours of nursing care, risk for infection will be partially resolved as evidenced by temperature going down to 37 degrees Celsius. White blood cell count will be back to 9 cells per cubic millimeters, and the lymphocyte percentage will go up to 30%. Okay, so next slide please. So we have here the independent nursing interventions with the following rationale or the corresponding rationale. Okay, so first we will monitor and reassess vital signs, especially the temperature. This is to establish baseline data and determine if the patient is still manifesting signs of infections. Okay, so signs of infection include high body temperature. Okay. So next we need, or as healthcare providers, we need to wash hands or disinfect before handling the newborn or perform hand hygiene. This is to reduce transmission of microorganisms from our body to the baby and vice versa. Okay. Next is we need to also monitor and recheck laboratory results, especially white blood cell count and lymphocyte level. And this is also to establish baseline data and determine if the newborn's immune system is still fighting off the infection. Okay, so next slide please. So here is the dependent nursing interventions with the rationale. So we need to administer ampicillin and amikacin as ordered by the physician. This is to help the newborn fight off the bacterial infection. Okay, so next slide please. Okay, so here we have the evaluation. So after 48 hours of nursing care, okay, that's a typographical error. So that would be risk for infection was partially resolved as evidenced by, okay, we have the temperature is back to 37 degrees Celsius. We have the white blood cell count, it's back to 9 cells per cubic millimeters. Excuse me. And the lymphocyte levels, or the lymphocyte excuse me, percentage is back to 33%. Okay, so next slide please. Okay, sorry. Okay, so we have the assessment. Okay, so another objective cues here would be mild shivering of the baby. We also have the flushed skin displayed by the baby, and the temperature is 38 degrees Celsius. Okay, so with those objective cues, you have come up with this nursing diagnosis, and this is our second priority: hyperthermia secondary to suspected bacterial infection, as evidenced by mild shivering and flushed skin, and also the high temperature. Okay, so our plan or objectives. Okay, so after 48 hours of nursing care, the hyperthermia will be partially resolved as evidenced by newborn or the baby having a temperature between 36.4 to 37.5 degrees Celsius or within normal range, and also the reduced shivering action of the newborn. Okay, so as nurses, next slide please. What we can do is monitor and reassess vital signs, especially the body temperature. And this is to establish baseline data and determine if the thermal regulation of the newborn has already improved. We can also remove the headgear or blanket on the baby to expose the skin of the newborn to room air and also decrease heat and increase evaporative cooling. Okay, we can also adjust and monitor environmental factors like room temperature and bed linens as indicated. This is to expose the skin of newborn to room air, decrease heat, and increase evaporative cooling. Okay, next slide. Okay, we can also keep clothings and bed linens dry. This is to promote comfort for the baby and help also prevent chilling, since the baby has also inefficient thermoregulation. So, upon evaluation, after 48 hours of nursing care, the acute pain was partially resolved. Or, sorry, that's a typographical error. The the hyperthermia was partially resolved as evidenced by temperature back to 37 degrees Celsius, and the baby is no longer shivering, and reduced flushing on the skin is observable on the baby. Okay, so next slide, please. Next, we have the another assessment of for the objective cues. We have the respiratory rate for the baby is 50 cycles per minute. We have the hemoglobin count, 20.5 grams per deciliter. Okay, so we also have the hematocrit level, 63.6 percent, and the newborn uses accessory muscles in breathing. Okay, so next slide, please. So this is our third nursing diagnosis: impaired gas exchange, secondary to polycythemia, as evidenced by hemoglobin count is equal to 20.5 grams per deciliter, and hematocrit level is 63.6%. Okay, next slide, please. Okay, so our plan and or objectives for the baby after 48 hours of nursing care: impaired gas exchange will be partially resolved as evidenced by hematocrit levels, or the hematocrit count of the baby will be back within 37 to 47%. Hemoglobin count will be back to within 12 to 14 grams per deciliter, and there will be absence of respiratory distress. Okay, so next slide, please. So as nurses, what we can do is again monitor and reassess vital signs, especially the respiratory rate. This is to establish baseline data and determine if the respiration of the patient has already improved. You can also check the oxygen saturation of the baby. This is to check whether there is a significant oxygenation problem uh, that can be observed within the baby. Okay, we can also position the newborn in a semi-Fowler's position, and this is to help increase oxygenation and help the newborn breathe easily. Okay, so next slide, please. So, dependent nursing interventions with Rationale include administering of oxygen therapy as ordered by the physician, and this is to also maintain the right oxygen level of the newborn's body. Okay. So, upon evaluation after 48 hours of nursing care, um, impaired gas exchange was partially resolved as evidenced by hemoglobin being back to 12 grams per deciliter. Hematocrit level is within 40%. Respiratory rate is within 45 cycles per minute, and the newborn has ease in breathing. Okay. Okay, so checkpoint.
Okay, so next is the checkpoint. So we will be answering questions. Next, next slide, please. Okay. So for the first question, this drug is used to treat certain infections that are caused by bacteria such as meningitis. So anyone can answer. So okay. May I call on Miss Del Castillo to answer the question? How about anyone is good to answer?
I'll answer instead. Just okay. So
Okay.
I think the answer for that would be ampicillin.
Okay, let us try. Next slide. Okay, very good. Your answer is correct. The answer is amphibian. Okay, next slide, please. Okay, another one. This is true or false. So BCG vaccine can be given to people receiving corticosteroids or other immune suppressive treatment, including radiotherapy. So is it true or false? So anyone can answer.
I'll answer. The answer is false.
Okay, thank you. So let us check. Okay, very good. So the answer is false. So it cannot be given to people. Okay, another question. This is true or false. So neonates are obligate mouth breathers and have narrow nasal passages. Is it true or false?
I'll answer. The answer is false.
Okay, very good, Dion. So the answer is false. Next slide, please. Okay, last question. So these complications appear when the placenta ages, except A. Fetal hypoxia, B. Fetal alkalosis, C. Placental insufficiency, and D. Oligohydramnios.
I think the answer is letter B, fetal alkalosis.
Okay, let us check. Okay, the answer is letter B, correct. This is fetal alkalosis. Next one, please. So that is all for our report of post-maturity of newborn, and here are our references.